So I had my son, Harvey, in 2019, and he had what multiple doctors quoted to me was the worst eczema they've ever seen. This just fueled my desire to make and produce natural, safe, and effective products even more, because now I was seeing this from the lens of a mom. Hi, I'm Dr. Alexis Reid, and I'm a chemical engineer, toxicologist, and a naturopathic doctor, and the owner of Eco Chic Movement. Our mission at Eco Chic Movement is safe and effective skincare. We are a non-toxic solution to your child's skincare needs. We infuse our oils with carefully selected herbs to provide babies with relief from their skin sensitivities without the use of harsh chemicals. All of our products are handmade in small batches to ensure quality and consistency. By combining safe and effective ingredients, we take the stress out of skincare.
Hello, so today we're going to talk about how to stop your baby's dependence on steroid creams and figure out the cause of their eczema. So stopping that cycle of it getting better and coming back. Okay, so I'm just going to give you a little introduction of who I am. My name is Dr. Alexis Reid. I'm a naturopathic doctor, and I have a master's in toxicology, as well as a bachelor's degree of chemical engineering. So I've been in practice for 9 years, which I'm like, wow, that makes me old now, as a naturopathic doctor with a special interest in eczema. I'm also the founder of the non-toxic skincare line for moms and babies called Eco Chic Movement that I'm sure you've heard about if you're at the summit. They're one of our sponsors, and I am mom to an eczema baby. So this is Harvey, my eczema baby. In that photo, he's around 18 months old. So this is Harvey. So on the left here, he's around 6 months old. This is around the same time that I was told that he had the worst case of eczema that they'd ever seen at our children's hospital. And then his after, he is at 18 months old, and he was pretty much fully resolved by that point in time. So what is eczema? And I should stop to say too, I say eczema because I am Canadian, and that's how we say it here. Eczema and eczema, same thing. I just can't say eczema, it comes out eczema, but it's tomato. So that is what I'm talking about if you're confused. So it's an inflammatory condition of the skin. So typically the skin is itchy, red, scaly, and dry. Common areas is behind the knees and elbows, hands, ears, and eyelids, stomach, so torso, face. It can also have small raised red bumps, and it can be dry or it can be weeping, and oftentimes it is itchy. So some stats on eczema. So currently 15 to 30% of children under the age of 5 suffer from some degree of eczema. In the 1990s, only 8% of children had eczema, and 5% of children have what would be classified as severe eczema. So eczema rates have been steadily rising since the 1990s, and eczema is more prevalent in North America than it is in other areas of the world. So when does eczema start? We usually see some sign of it starting around 3 months. And then another peak of the onset of eczema happens again around 5 to 6 months. And this tends to be, especially if it is food related, with introducing solids. Most children who are going to develop eczema will have had some amount of it by 2 years of age. And I have found in my practice that it tends to be at its worst or at its peak between 6 to 18 months of age. So one of the most commonly asked questions I get is, is this eczema? Name that rash. If you're on any Facebook mom group, like, name that rash. So I just thought I'd do a quick little overview of what eczema looks like versus other common skin conditions in children. So as I said, eczema typically doesn't start before 3 months. That's not to say that it can't, but typically doesn't start before 3 months of age, can be dry or weeping. Tends to present on cheeks, neck, elbow creases, and behind the knees. Can also be on the torso, and it can be itchy. It quite often is itchy. Versus baby acne is one that I get asked about a lot. So baby acne typically starts between 2 and 4 weeks of age, so when they're much younger. It looks fairly similar to adult acne, like red bumps. They can look pus-filled, usually on nose, chin, cheeks, and forehead. It can extend up into their hairline. Lots of babies have small white bumps on their cheeks and nose. That is called milia, and that's nothing to be concerned about. That is not baby acne. And baby acne typically clears up between 3 to 4 months. Now, the cause of baby acne is unknown. It doesn't require treatment and it will clear on its own. What you can use on baby acne, if you are breastfeeding or have access to breast milk, you can put a little bit of breast milk on it, or any gentle moisturizer just to help keep it moisturized. So I have some pictures here. So I just have notes too, so to make sure I don't miss anything out of my memory. So just to look at the difference between eczema and baby acne. And I wanted to share a picture with a darker skin color for eczema, because often when we think of eczema and when you read anything about eczema, it says red, red, red skin. And that is the case, but often in darker pigmented skin, it can just be, it doesn't look quite as red, it's more of a darkening. So this is behind the knees, which is a common area, and it looks like darker, scaly, looks different from, the typical normal skin. Versus baby acne, and it can be difficult for parents because, yes, at first glance, this baby acne, it looks red, it looks inflamed, irritated. It definitely could look like eczema, but if you look closer, you can see the acne appearance. That's also coupled with the age of onset. This baby doesn't look very old, looks like 2 to 4 weeks old, possibly. And another way to figure out if it's baby acne or eczema is to see if it's bothering them. Like, they typically tend to be unbothered with baby acne. And you can see that on this baby, it has extended to the chest a little bit. So another one that I often get asked about is eczema versus cradle cap. So I won't go over the eczema again, but cradle cap has a really wide range of when it can start. So it can start anywhere between 2 weeks of age up to 12 months of age. It's red, scaly, yellow, crusty patches on the scalp. It can engulf the whole scalp, doesn't tend to be itchy. And it is thought to be caused by too much oil on the scalp mixing with a yeast on the skin called malassezia, and the two of them come together to form cradle cap. Cradle cap is also linked to gut dysbiosis, which is something that we will talk about a little bit later on. So we will get into that, but for how to treat cradle cap, it's usually fairly uncomplicated to treat. I generally recommend applying an oil to the head. Our Eco Chic baby oil works really well for about 30 minutes, 20 to 30 minutes before their bath, and then lift. That helps to lift the crust. So to lift that with one of the cradle cap brushes. So I like the Frida baby one, it works quite well. And then comb that out before the bath, and then you can comb out any extra flakes after the bath. It should resolve by 12 months of age typically, but it can return in childhood as dandruff. And again, that's also linked to gut dysbiosis. So we'll go into that more later. So here's just some pictures so you can get a visual. On the left here is a pretty, that's a moderate eczema, typical of what we see in babies, red on the cheeks. And then, on the left, and then on the right here is cradle cap. So look, this is more of a yellow variety, thick, crusty, right in the hair and on the scalp. So what are the common causes of eczema? So eczema definitely has a genetic component. So we do know that people with a predispositions with a loss of function mutation in the filaggrin gene. So what does that mean in English? So the filaggrin gene produces a protein that's in the outermost layer of the skin, which is called the epidermis. So that protein helps to keep your skin intact, like in a nice smooth layer with no holes or cuts or bumps, essentially. So people who are predisposed to eczema may be missing some of these proteins, so their skin is not in as nice of a smooth, complete layer. A child is more likely to develop eczema if one or both parents suffers from eczema or had eczema as a child. And people with allergies and asthma have a higher risk of eczema. This is called the atopic disease triangle. So anyone who has allergies, asthma is more likely to have eczema. Same thing, if you have eczema and asthma, you're more likely to have allergies. They go hand in hand. So there's many different causes of eczema. Most people have a few different things that are triggers for them. So we will dive more deeply into what is going on typically for babies. So food and environmental allergies are big ones. The big ones for eczema, which again we'll dive into, is dairy, gluten, not as much in children. I find that more in adults, eggs, citrus, tomatoes, dust, pets, and metals. So gut dysbiosis. So everyone has within their GI tract probiotics and good bacteria and bad bacteria. And these bacteria make up, these bacteria and other species, there's fungus and yeast and different things in there too, but that makes up what we call your microbiome. And so much of our immune system is modulated or controlled, changed by our microbiome. So a lack of diversity in microbiome, so not having a variety of different bacteria in your gut tract, is associated with eczema. And some causes of that are antibiotic use, lack of fermented foods in our modern diet, being born by cesarean, or being formula fed. And this is not coming from a place of like guilt or shame associated with this. Often these things are unavoidable, and we will talk about how to overcome this. So allergies. While we're talking about eczema, I'm going to pop in for a second and talk about allergies, because I said that they're often interconnected. So it is good to note that a high percentage of children with moderate to severe eczema will develop food allergies or asthma. And currently it's sitting that about 10% of children have a food allergy in North America. So this is something to be mindful of. One of the hypotheses of why eczema could relate to food allergies is especially with moderate to severe eczema that is on the face. And when babies are starting solids, babies are messy eaters, they're getting food all over their face. So in our typical situation, what happens when we eat a food is we eat it, it goes through our digestive tract. So the first exposure of the proteins, the allergenic portion of that food to our body is through the GI tract. Now, if baby has moderate to severe eczema and open skin, and they're eating, we'll just say peanut butter, for example, common allergen, they're eating peanut butter and smearing it all over their face, and it's going through their skin. Now one of their body's first contacts to that allergen is through the bloodstream, because it goes through the skin and is absorbed by the bloodstream. So it's through the bloodstream, it's not through the GI tract. So that can result in allergies. So that is something to consider. That's why barrier function, and we will talk about that, is so important in eczema. And I often suggest to parents with children with open skins, moderate to severe eczema, to put a diaper cream or a barrier cream on their face before feeding to help reduce that risk. Now, eczema is complicated, as you may have guessed already. So it is multifactorial for most people. There's usually not one contributing factor that's causing the eczema. And also what works for one person won't necessarily work for the next person. And as someone who owns a skincare line that, deals with people with sensitive skin, there is no magic bullet cream. I will be the first one to tell you that there's no magic bullet cream for every person's eczema. And as you can see on any Facebook mom group, almost every person has a suggestion of something different that was that miracle cure for their child's eczema. So today we're going to really dig into the most probable causes of your child's eczema and give you a step-by-step plan of how to figure out what the causes are. So I'm going to talk a little bit about the skin method. So the skin method is something that I've developed that we'll dive into. So it's skin, S is for soothe, K is for knowledge of triggers, I is for inflammation and immune system, and N is for nutrients. So from my 9 years in practice, I've treated thousands of patients, and I've developed my skin method. So this is a comprehensive system I use to help children figure out the cause and heal their eczema from the inside out. So this is the framework for my 6-week program that's called the Eczema Eraser Academy. So the framework builds on itself. So today we will go over the S and the K. So S is for soothe. This first step of soothing the skin from the outside is often enough for children who have mild eczema. But if topical solutions are not working, the next thing I always look at is triggers. For cases that did not resolve with trigger elimination, we move to inflammation and the immune system. And finally, for the most stubborn cases, we move to nutrients that can help eczema. So my goal for this talk today is to leave you with actionable steps to get you started down the path of figuring out how to manage and overcome your child's eczema. So because the system is very complete and takes time to work, we're going to cover some of the S and K today, as figuring out how to soothe their skin, as well as removing topical irritants and toxins in the home, and learning how to figure out triggers are the 2 big steps that will help get you started seeing major sustainable improvements in the eczema and get you out of that steroid, gets better, comes back, endless cycle. So I want to get you seeing results as quickly as possible, and this framework will help us guide through that process. So we're going to jump right into soothe. So I talked a little bit about it before. The skin is an semi-permeable barrier. So oftentimes people think that your skin is like this. Your skin is also your largest organ, that the skin is this magical barrier that nothing goes through. And things that you put on your skin aren't important, which is evidenced by, like, there's plenty of drugs that are delivered through the skin, like there's a birth control patch. So things go through your skin and get into your blood system. It should be semi-permeable, so it should be like a coffee filter. In a coffee filter, the water, aka coffee, gets through, but the grinds stay in the filter. So it's similar with your skin. So what you put on your skin does matter, and it does get delivered directly to the bloodstream. So I'm going to dive into all things topical, what to use to soothe the skin, and also what to remove from your home environment to reduce irritation to the skin. So I often talk about wanting to avoid the dependence on topical steroids and immunomodulators like Topic, which is also called tacrolimus. I totally understand that at some point in your eczema journey, if things got really bad, you may have needed to use medications, and we did as well, but they don't get to the root of the problem. So you often get stuck in this rebound effect and cycle of using them. The skin gets better, you stop, it gets worse. And we saw that with Harvey as well. So I am not against using them, but I prefer to use them as a tool to calm the skin down while figuring out the underlying causes and triggers. So what to remove? So skincare. So skincare obviously is one of my passions and one of the areas that I have along with eczema, dove deep into. So I always like to help let people know things about skincare that aren't common knowledge. So one of the big ones is fragrance. And fragrance always contains parabens or phthalates, even if a product is labeled paraben free. And this is a big one right now in the industry with, you know, the big players. They're recognizing that consumers, especially in the baby and child space, want to move to a more natural option for skincare for their child. So they are coming out with paraben and phthalate free brands, which is good on the surface, but there is a loophole in North America that a fragrance is considered proprietary information of the company, so they don't have to disclose what is in it, even if they contain parabens or phthalates. So you can have no parabens or phthalates on your label and actually have parabens and phthalates in your product as long as you list it as fragrance or perfume, P-A-R-F-U-M. So that is a loophole of fragrance, of parabens and phthalates being in skincare products. So how you can get around this is to look for no fragrance or things that are scented with essential oils only. So yeah, parabens and phthalates we don't want. They're hormone disruptors. They're just not something that we want to be putting on children's skin. Next one is petroleum products. So that's things like Vaseline and mineral oil. And the little memory trick I have for them is Vaseline equals gasoline. They're commonly contaminated with known carcinogens, such as 1,4-dioxin. And Vaseline just really isn't a moisturizer. It doesn't act to penetrate the skin and help heal anything. It just sits on top as a barrier. You want to avoid allergenic oils. So similar to how I was talking before about when a child is learning how to eat and that is going through the skin, you don't want to be putting allergenic oils on the skin, especially skin that has eczema and may have openings, because allergenic proteins from that oil can travel through the skin into the bloodstream. So you want to avoid things like almond oil, walnut oil, any of the tree nut oils for sure, peanut oil as well. Sodium lauryl sulfate is more commonly known as SLS, and this was developed in World War II as a way to degrease the floors on ships in the war. So it's very harsh, and it's often found in liquid soaps and shampoos, and it really disrupts the barrier of the skin. And under the same vein, you want to avoid soaps that disrupt the pH balance. So environment. So what you put on your skin is very important, but also the environment that baby or child is in. We spend a lot of time inside. Most people's inside air is heavier in toxins than outside air. So it's definitely something that can be an easy switch, and it's something that you should look into. So things like fragrances, air fresheners, Febreze, room sprays, scented laundry detergents and fabric softeners are another one to remove, and heating food and milk in plastic. So that's bottles or food. So removing toxins from babies' child's environments, always a good idea because they're more susceptible to these toxins. And baby and children are more susceptible because they have a higher percentage of body fat. And these toxins are what we call fat loving. So what happens is the body has a protective mechanism to take these toxins out of the bloodstream. It stores them in the fat cells. But this is a problem with children because children have a higher body fat percentage. And as they grow, toxins are then released from their fat, as they grow over time. So these toxins stay with them for a long time. Many of them are also known neurotoxins, so it can hinder development there. And babies do not have as mature of detoxification enzymes in their livers as adults for breaking these things down to make them water soluble so we can excrete them in urine or stool. So babies have a lot against them in terms of being able to eliminate toxins as well as adults. And the other thing is the skin is a major organ of elimination. So toxins are eliminated through the skin, which is irritating to skin, especially if it's already inflamed and irritated with eczema. So you just want to try to mitigate any of that. So another big one in the eczema world, contentious topic, is bath time. There isn't a consensus on bath time. You can ask, 10 dermatologists if you should bathe them once a week or every day and get 50% on one side and 50% on the other. So there is no real consensus there. So I will talk about a few of the things that I do think are important in bath time routine. I would suggest using soap as infrequently as possible. You don't want your baby or toddler to be like a dirty mess, but they probably don't need it used at every bath. So trying to use it for when they are like really dirty. If you are on municipal water, so in a city or town, using a chlorine filter on your bathtub can be quite helpful because chlorine can be irritating to eczema. And I linked one under there, VitaFresh. It's a vitamin C, so vitamin C neutralizes chlorine. Vitamin C based shower filter. It's really accessible. You can find it quite easily and it's easy to install and it lasts for quite a while. And one of the big things with bath is that after bath, the creams and moisturizers that you're putting on should be applied to a damp skin, not to fully dry skin. That helps them be absorbed better and helps with moisturization. And I suggest you use a Castile-based soap as they do not disrupt pH balance and they're nice and gentle, especially for babies and little ones. Okay, now creams and more creams. So everyone always wants to talk creams and the magic cream with eczema. So this is the typical situation that I see. Typical recommendations here in Canada anyway. We have people from all over the world, so things may be different in different parts, but typical recommendation is Galaxol base. So Galaxol base is often recommended as just that overall moisturizer. And I actually, funnily enough, worked for that company during an internship in my chemical engineering student days. So it's funny, things have come full circle. And Galaxol base is not as bad as it used to be. It used to be a lot worse, but it's still high in petroleum and paraffin wax, which is often contaminated with 1,4-dioxin, and there's just better options. Vaseline equals gasoline, uses a barrier to help what you put underneath soak in. Again, better options. Then hydrocortisone. So in North America anyway, a 0.5 or a 1% are available over the counter. This is usually the first thing that gets tried with any baby eczema. It can be helpful to get through flares, but long-term there is risk of thinning the skin with a steroid, not as much at the 0.5 to 1% level. That's more like a Desonide or a Betaderm. But you get into that cycle of you're only supposed to use them for 2 weeks in a row. So you use for 2 weeks, gets better, stop, gets worse. You get that whole rebound cycling. Now, Desonide is what they call a low potency steroid. So it's higher than 1%. It's used to help with flares. I did use this occasionally with Harvey when introducing new foods if a food was flaring him, so it can be quite helpful there. And then Betaderm is considered a medium potency steroid. It's not advised to use on the face, but many dermatologists do use it off-label for that purpose, and we had to do that as well at one point in time. And you have to be careful that they don't touch it and eat it and use it very sparingly. So it's a difficult one for parents too. It's a lot on you. And then I talked about Topic and Elidel are two of the newer ones that are getting prescribed more often for baby eczema. They work under an immunomodulator premise, but you get into the same rebound cycle. And then DermaSmooth is more for cradle cap, not eczema. But one of the things about DermaSmooth is it's in a peanut oil base. So it's not the best choice in these already atopic allergic potential children. Okay, so other options. So for overall moisturizing, there are a lot of other options. So my company, Eco Chic Movement, makes a baby lotion that's just for, general overall moisturizing, very good for sensitive skin. If you have very dry skin, it often needs ceramides. So ceramides are a protein that our skin, or a fatty acid that our skin makes in the outermost layer. Oftentimes people with eczema are a little deficient in this. So if you're very dry, ceramides can be helpful. I like the Mustela Stellatopia emollient cream for ceramides, as well as CeraVe baby moisturizing lotion. Those two both have ceramides. For spot treatment, we do have the Eco Chic Movement skin conditioning cream, can be helpful for, you know, any of those red persistent areas. And then in place of Vaseline, what I like to use as the seal is the Live Clean non-petroleum jelly. I'm just looking to see. Oh, my phone's going off. Yeah, that's everything I want to say. Oh, and one of my favorite tricks with cream, with, you know, any cream that you're using, is to put a drop of vitamin D into the lotion that you're going to apply to their eczema inflamed areas. So like Protopic, vitamin D can have effects on modifying the immune system in a positive way. So it's very helpful for their skin health. So that is one of my favorite little trade secrets for moisturizer and eczema. So laundry is another really big hot topic with eczema, and it can be a big factor for eczema in children. You know, they're wearing clothes a lot, they're skin sensitive, especially sleeping in cribs, on beds, rubbing their face on the sheets, all that sort of stuff. So ivory snow is usually, anyway, in my circles, the #1 that gets recommended at baby showers and all that sort of stuff. It's not my soap of choice. It contains fragrance. It's not the best option. So one of the first things I usually suggest with baby who has eczema is switching out their laundry soap. So my favorites are 7th generation free and clear is my #1. Or if baby is highly sensitive and you suspect that there is any issues with like coconut, because coconut is in all natural laundry soaps. I haven't found one without it yet. I do recommend Tide Free and Gentle, as much as that pains my non-toxic heart. It can be helpful with a complicated eczema baby. So some little tricks for eczema. Soap residue can cause a lot of skin irritation. So a liquid laundry soap rinses out a lot better than a powder. And I always suggest for babies' clothes, especially, setting the washing machine to have a double rinse cycle to make sure that everything's getting rinsed out well. Okay. So clothing and pajamas are another big one. Again, talking from a North American perspective, here in North America, flame retardants are added to children's pajamas. Flame retardants, all of them, unless they are organic cotton or bamboo, and they have a tag on them that says that it does not contain flame retardants and should be tight fitting. So flame retardants are hormone disruptors and linked to increased risk of cancer for all children, but especially with sensitive skin and eczema children, they're irritants. And Emma from Green at Home, who's doing one presentation here as well, she has a very comprehensive blog post on this on her site, so that is something you can reach out and read. So one way to avoid this, and some of the best fibers I find for eczema skin anyway, is cotton, organic cotton, and bamboo. I particularly like bamboo for eczema because it also helps temperature regulate, so they don't get too hot and have that as a trigger for eczema. I would also consider switching their sheet to bamboo or organic cotton, especially if the eczema is on the face and they're old enough that, you know, they're rolling onto their stomach and stuff like that at night. That can definitely be irritating. Okay, so moving on from soothing into food triggers. So in my experience, most common food triggers for babies is dairy, eggs, tomato, citrus. Gluten is in there, but I see that more in adults. So dairy is a big cause for confusion because I get asked all the time, you know, oh, you think my baby is sensitive to dairy? We'll switch to lactose-free products. And I just wanted to talk about this for a minute because those are not the same thing. So lactose intolerance is when someone has a deficiency in an enzyme, lactase, to break down lactose. What we're talking about here is a different situation. It is a sensitivity to the protein. So there's a sensitivity to whey or casein. So if you switch out your milk, cheese, yogurt, etc., to lactose free, it still has the protein, so that won't help the issue. So when you're looking at removing dairy from baby or yourself diet, there's your typical culprits: milk, cheese, yogurt, ice cream, etc. But dairy is also an added ingredient in a lot of products. It's often listed as modified milk ingredients, and there's a bunch of other names of ways that dairy is added to products. Now, eggs is a big cause, unfortunately, because they are a great food, is a big cause of eczema in children, particularly the egg whites, and we'll often see itchiness with an egg sensitivity. Tomato can be a cause of eczema, and you'll often see it can cause diaper rash as well. Peppers, white potatoes, and eggplants they're called nightshade vegetables. They're members of the same family. So they have a component in them that makes them inflammatory to some people, so they can trigger sensitive individuals. It's called alkaloids, and that makes them more inflammatory to some people. And then with citrus, we're talking about oranges, lemons, limes, and grapefruits. So I'm just going to talk briefly about allergy versus intolerance. So when we're talking about an IgE allergy, that is like an immediate life-threatening anaphylactic reaction. So you can have blood work done to see levels of IgE drawn, and that's also when people go to the allergist and they get skin prick testing, that's what they're looking at. A non-IgE allergy is a delayed reaction or intolerance sensitivity. It could be mediated by IgE, but not all are. So having a food trigger eczema or colic or reflux does not mean that they're allergic IgE to a food. They could be, but it's not a sure thing for sure. Now, there's some issues with testing because the skin prick test, which is how you generally test for an IgE allergy, it's not considered accurate in babies under 1 year. It's also not accurate if a baby hasn't eaten that food yet. So oftentimes parents will say to me, well, I'm concerned my child may have a peanut allergy or egg or dairy or whatever, and they're only 6 months old and they haven't eaten it. So a skin prick test is not an option at that point in time. A skin prick test is also less reliable in a child who is covered in eczema because that can give a false positive. Their skin could just be reacting because they have reactive skin. Oftentimes we see that it is non-IgE mediated reactions that cause eczema. So the testing for those is also not great. So the best way to figure this out is an elimination diet scenario. So I will talk about this briefly. I usually go more into this, but Dr. Trill is doing a whole talk on this, so I will just keep this brief. So how do you eliminate? So the typical recommendations for elimination diet is if there's a food that you suspect, you start with that one. Now, skin cells, so with eczema, skin cells take 28 to 40 days to fully turn over or have like new baby skin cells become adult skin cells. So it can take up to a month to see improvement with eczema. That's not to be confused with, and Dr. Trill will talk about this, I'm sure, that proteins do not take that long to clear from breast milk. It's just that the skin cell turnover takes 28 to 40 days, so it can take that long to see a change. So I generally suggest waiting 1 week between food trials. The other approach is to take out all possible foods and then reintroduce foods step by step. This can also be done if mom is breastfeeding. This is something that I had to do with Harvey. I had to figure out what was going on with him. I had to eliminate foods and go on a 5-food diet for 16 weeks, and that is awful, and I do not recommend it, and I try to avoid that if at all possible. So that if you are in this sort of situation, I definitely recommend attending Dr. Trill's talk. So beyond the common allergens that I talked about that can cause issues with eczema, these are the ones we tend to see causing issues in babies and children. So one of the big issues is that 75% of people with CMPI, which is cow's milk protein intolerance, are also sensitive to soy. These babies are also often taken from their dairy-based formula to a soy-based formula. So when 75% of them are sensitive to soy, that still causes a lot of issues. And this is across the board. It's not just eczema. This is also for things like colic, reflux, etc. So also Robin from Breastfeeding Dietitian has a talk going on about colic and reflux. So that's a good one for that. Other foods that people often don't suspect, but can be big causes of eczema in babies is beef, chicken, oats, rice, and coconut. So if you have an eczema sensitive child and you're struggling and you really want to scale back their diet or your diet to figure out, the best meat is lamb because it's still high in iron, which is important in babies and toddlers, and it's well tolerated. Other options are wild game like bison, moose, and deer. So breastfeeding, so allergens definitely can pass into the breast milk. Again, Dr. Trill goes all through this. So mom eliminating those foods can have a positive effect on eczema, and it does not take weeks to be making hypoallergenic breast milk, which again is a common misconception that can happen as early as 24 hours. The other big one that I often see overlooked is supplements. So any supplements mom is taking can contain allergens. Quite often soy is used as a preservative in supplements, so that's definitely something to look out for. Hypoallergenic formulas, these can be needed if baby is formula fed or if they're having trouble with weight gain and they want to top up with formula. So there's sort of a spectrum of those. Partially hydrolyzed formula, these are what we think of as like easy to digest for babies that are having tummy troubles, things like Enfamil Gentles. Then we have a hydrolyzed formula. So this is where the dairy protein is broken down to the point that it shouldn't bother a baby who has a sensitivity, but a baby with a true IgE allergy can still not use one of these formulas. And they are Similac Elementum, Enfamil Nutramigen, and HIP Hypoallergenic. That one's from Germany. That one is my favorite of the three because if you have a child who is not a newborn and who has been having breast milk or formula for some period of time, both the Elementum and the Nutramigen smell really gross and they don't taste good, and babies often refuse them. So my favorite in that scenario is the HIP Hypoallergenic. If you have a baby that is extremely allergic, IgE allergy, you need something that they call an amino acid formula. So those two are pure amino or neocate. They are quite expensive and have to be ordered from the pharmacy. And most insurance providers, if you have a note from your pediatrician, you can get some coverage for them because they're quite expensive. So the other big thing that I've talked about and we're now circling back to is gut health. So with gut health, I talked a little bit about it before, but seeding is how the baby gets its microbiome in its gut, because when a baby is in the uterus and developing, it does not have any bacteria in its digestive tract. That bacteria gets in there when it is born. So when a baby is born vaginally, they ingest bacteria from the vagina and stool, and that forms the beginning of their microbiome. Then this is the ideal situation, I should say. Then they are fed breast milk, which contains pre and probiotics. So prebiotics are the food for probiotics, and that helps their gut bacteria to grow and flourish. And this situation that I just described is like in the perfect world, utopia. This is what happens. And then we'll talk about real life on the next slide. So gut health obstacles. And again, I want to say that this is not coming from a place of guilt or shame. Many times these interventions were unavoidable in your situation. And I know personally that I spent way too many late night Googling and wondering if the antibiotics that I had in labor contributed to Harvey's severe eczema. So definitely understand where you're coming from in that regard. And it's not, in any sort of a blame capacity. It's coming from a place of, when we know what the obstacles are, then we can start working on how to overcome those obstacles. So Harvey's yelling downstairs. Cesarean birth. So in cesarean birth, because their first contact is with mom's skin, they get seeded with skin bacteria. So things like Staph aureus, instead of the bacteria from the vagina and the stool. Formula feeding doesn't have pre or probiotics in it in the same capacity as breast milk. And probiotics help the microbiome to flourish. So, but the good news is that even a little tiny bit of breastfeeding, especially if it's colostrum, can really help the good bacteria to grow. So a good talk to watch on that is Kelly Kendall. She talked about hand expression that can be quite helpful. Antibiotics in labor are very common practice if you're group B strep positive, but this can change the mom's flora before baby is born and then in turn change the seeding of baby having antibiotics. So if they need them, they need them, but that can also change the bacteria in the gut. But all this is not doom and gloom. So the microbiome is one of the most highly researched areas in medicine right now. And we do know that everyone is able to modify their microbiome. So adults, up to 90-year-olds, like everyone is able to modify their microbiome, but we are especially able to modify microbiome under the age of 3. So new studies have actually shown, which is super cool, that supplementing a baby with probiotics can make the microbiome of a baby who was born by C-section, formula fed, and had antibiotics be the same as a baby who was a vaginal birth, breastfed, and no antibiotics by the time they're 3, which is amazing. So that really helps take that blame and shame game away too, because you can sort of turn back time and reseed their microbiome so that you would never know the difference by the time they're 3. There's lots of things that we can do to help support microbiome. So I talked about fermented foods in the past. So getting things back into the diet, you know, again, I know it's not like toddler friendly foods, but things like kimchi and kombucha and sauerkraut, those sorts of things. Also playing outside in the dirt can help with their microbiome, as well as children who take frequent trips to farms have a more diversified microbiome. So there's we're learning more and more about the microbiome every day, and it's super interesting just to know, you know, the things that can be done to help overcome these obstacles. And then probiotics. So I talked a lot about the role of gut dysbiosis and the role of probiotics. So again, adding those fermented foods to the diet can help. And prebiotics, so the food for probiotics, the most important prebiotic is called fruit oligosaccharide, and that can be found in onions, asparagus, bananas, garlic, honey, and leeks. So, you know, a lot of those aren't super baby-friendly food, but giving your baby banana can help give them food that they need for their probiotics. Now, there's been quite a bit of studies on probiotics for eczema, and the two that have come out on top as the most relevant for eczema is Lactobacillus rhamnosus and Lactobacillus reuteri. So those are the two that we're looking for in a probiotic supplement. The other thing I often caution parents about is probiotics are often grown on a dairy medium, and dairy is often an issue in eczema. So if you have a baby and colic and reflux and all these other sorts of situations. So if you have a baby that you suspect has an issue with dairy, it is important to use a dairy-free probiotic. So my favorite probiotic for eczema is dairy-free. It's Organica Baby Probiotics. So it contains Lactobacillus rhamnosus and reuteri, and it also has vitamin D. So it's very much like a all-in-one solution for eczema. I really like it. I use a lot in my practice. And then talking about vitamin D. So vitamin D is called a vitamin, but it's actually more like a hormone. It helps to regulate your immune response. So a regulated immune system produces less inflammation. Now in Canada, we're not able, so we produce vitamin D in our skin, and that happens from the sun hitting our skin. So in Canada, we're not able to produce vitamin D from the sun from October to May because of the angle of the sun. And in the US, it is, I gotta look here because my US geography is not fantastic. It is anyone above the 37th parallel. So the 37th parallel goes across the southern border of Colorado and Kansas, right across. So anyone who lives north of that is not able to produce vitamin D from the sun year round. And in Europe, actually surprisingly, it is right at the bottom of Europe. Like even the south of Italy is above the 37th parallel. So there's a lot of people in the world who are not able to produce vitamin D in their skin year round. So vitamin D supplementation is an important part of the picture with eczema. And I said before, but vitamin D is helpful both taken internally, and I also like to add a drop or two applied to the creams that are applied to the skin. And something I don't think I said is with vitamin D, it is a fat soluble vitamin. So it is important that you take that in a liquid or capsule form that's in oil, not in a tablet. Because if you're taking it in a tablet, it's not going to be absorbed properly by the body. It needs to be in an oil, so either in a capsule or in a drop. All right, now we're coming to the end here. I'm just going to give you some pictures of hope, possibly. Not this slide, next slide. So these are all pictures of Harvey at around 6 months of age. So as you can see, his eczema was quite severe, all over his body, neck. He's like 6, maybe 7 months old, not bassinet. He had to have socks on his hands at night because he would get attacking and itching, and it was quite bad. And then these pictures are progression. So in the top left, he had a really persistent spot on his cheek. He's around like 13, 14 months there over the summer. That's Halloween. He's Bob Ross, if anyone knows that reference. He's around 16 months old there. You can see the cheek is still there a little bit. And then in the final picture on the bottom left, he's 18 months old. So we didn't see a full resolution until 18 months, and he's now 2.5 and fairly eczema free. The occasional small flare in the winter because we live in Ottawa, it's quite cold here and dry. And the picture that is the back of his knee crease there. So yes, definitely lots that can be done to help improve eczema. And everyone who is at the talk will also get my downloadable guide. It's five things that may be causing your child's eczema, so everyone will get that. And then, yeah, able to take any questions. And if you want to have, be in contact after the talk or learn more about the eczema, you can send us an email to info@Eco Chic Movement. Our website is ecochicmovement.com, and then we're also on Instagram @Eco Chic Movement. So yeah, thank you very much, everyone, and I hope you enjoy the rest of the summit.